My name is Isadora Thompson, and I'm going to be demonstrating how to do a sterile dressing change. The first thing we need to do is we need to check the physician's order. We need to look and see if there's any special instructions required with the dressing change. Some facilities might have this on a Cardax after it's been noted by the nurse. So I've looked at the physician's orders. I know that I need to do a sterile dressing change, and I've gathered my supplies. I need to wash my hands. I will check all of my supplies. I need to look for an expiration date, make sure that it's intact, it's not wet, there's no spots or stains that would clue me into that it had been wet, it's not ripped or tore. And I'll proceed to do that with each and every one and make sure they're not expired. And some of these will not have an expiration date, and they look good. And so I need an ABD and 2 packages of 4x4s. There's 2 4x4s in each one, and I know that on my dressing that I have a total of 4 4x4s. Then I need a pair of sterile gloves and make sure that they're appropriate size. You want to make sure that you do not have any jewelry or anything on. Have a clean working surface, and you want it to be at about waist height. You'll need some tape, some clean gloves to remove the old dressing, and a biohazard bag. I want to look, when I'm looking at my physician's orders, to see if my patient has any allergies to latex or tape. And then I'm going to want to go in and pre-assess my patient to see if he's having any pain. So my patient is Mr. Smith. So I'll go into the room and introduce myself. Hi, my name is Isadora. I'm a nursing student, and I'll be working with my clinical instructor. Can you state your name? And he says Mr. Smith, and your date of birth, and he gives me that correct. And I ask him if he has any allergies, and he says no. And then I actually want to look at it, and it's crossed over there on the other side, but you'd actually raise it up and look and match it up to make sure. I asked Mr. Smith if he has any pain. He says no, he doesn't have any pain. So I'm able to do my procedure. I've provided privacy, and again, like I said, I've washed my hands, and I want to raise the bed to an appropriate working height. Okay, and then I'm going to put my side rail down and have my table nice and close. For demonstration purposes, I'm going to try and move this enough that you can see. Can you see it? Okay? Okay. Generally, you would want to leave the patient covered as much as possible to get so that you're providing them with privacy. And make sure that they're comfortable. You don't want them to be in an uncomfortable position and that we're close to working. So I'm going to take a biohazard bag, and this is a clean, not used biohazard bag, and open it up nice and set it right there. I'm put on my gloves. I also recommend that you make sure that your sleeves are up, so when you're doing the sterile that you don't brush your sleeves against things. You want to peel off the tape, and you want to do it gently. Some patients have very fragile skin. I like to bend my pieces of tape over, and we're going to tape this a little differently than how this is. You want to make sure that there's as minimal tape as possible to keep the dressing secured, but you don't want real long pieces because some of these patients will have dressing changes for weeks on end. When you go to open it, you want to lift your dressing up like this so that the patient cannot see. Some of them will get upset stomachs or nauseous, and they don't want to look at their incision. And then I want to look to see if there's any drainage. And there's no drainage on this one, so I can go ahead and get rid of it. Then while I'm taking it off, I want to take it off, and there's one. And if you look, this is a serous sanguineous drainage, so make sure that you know how much. And how you define how much can vary amongst you. Some people will say, oh, that's about a 2-inch by 3-inch, or they might say 3/4 of the 4x4. Or sometimes if you get in a smaller drainage, you might say dime-sized, quarter-sized. But just remember for documentation purposes. So then just keep removing. And so if truly I had removed this and there were 2 and they were soaked onto that ABD also, then I know that I need to put more on. Or if you take them off and and there's hardly any drainage, then you might be able to back off on the dressings, because some of these are kind of expensive charged for the patient. So once I remove this, I'm looking at the incision. And what I'm looking at the incision is, are the edges approximated, which means that they're touching together, or is there dehiscence, which means that the wound has started to pull apart. I'm looking to see if there's staples or sutures, is there a foul odor, is there erythema, edema, any red lines leading away from the wound. All of these are signs of infection and that you need to be monitoring for and notify the doctor. Is there a purulent or pussy drainage coming out? And this just has a serosanguinous, and the incision is well approximated. We'll say that there's no erythema or edema, there's no foul odor, and so I can dispose of that. Then I can get rid of these gloves. Next, what I need to do is I need to open up my packages. And there's different ways to open the package, and it doesn't matter. I like to loosen mine up, and then I hold, can you see that? I like to hold it like this, and then I pull back, and then I tuck my edge down like this. And that's how, then that won't pop back over, and I'm less likely to slide this 2x2 off. Because you need to keep it as close to center as you can, because you have a 1-inch margin coming in around this. Generally, you don't want to be talking over your sterile field. Your work surface is nice and clean and dry, and you do not want to reach your hands like across your sterile field. So this package is good. Then I'll go to my next one. And it's okay for this to hang over the edge, because I have plenty of room to work with for the rest of that to be sterile. Now, the other thing that I need to be concerned about is that I don't step too far away from the patient. So what I would recommend is going like this. I can still see my sterile field. I'm right beside the patient. I'm not way over into here. Get this out of your way. You don't need that. And I'm going to open my sterile gloves. Now I want to make sure that when I open them, I don't want to turn them this way and open, because then I'm liable to put that over top of my ABD, and then that's contaminated and I wouldn't be able to use that. Okay, I want to put on my dominant hand. And then I can come up here and I can adjust these. Okay. Now, I like to use my foot if I need to move my table at all. So the first thing I want to do is I want to reach in, pick up my ABD, or my 4x4, and drop it. Come in, grab my other 2 4x4s, and drop it. Now, reach in, and I'm lifting straight up when I do this. So then that way I'm lifting straight up. I don't want to slide it this way or across. And I can open it like this. And remember, so since both my hands are sterile, I can touch this like that if I so choose. And drop it. Things to consider is to be careful that when I don't touch my ABD anywhere along and through here, that I don't put my hands below my waist, that I don't brush my hands on any of these linens or the gown, or touch my hand on the table. If I do any of those, then I've contaminated, and I need to say, I contaminated, and how I would do to correct that action. Once that's on, we don't have to be sterile anymore, so it doesn't matter. So that's on, and I left it like that. And I'm going to tape it down. And I just match up the tape so it's the appropriate length of the ABD. And tape it down. And you can take your gloves off too, as long as that there's not any drainage on the surrounding tissue. And if there was a ton of drainage, it was leaking all over, then I might need to wear a face shield or a gown, other protective materials required besides just gloves. So keep that in mind when you're doing this. So I measure for my tape. And the reason we don't want to put a bunch of tape, again, like I said, is just we don't want to adhere it onto that skin any farther than we have to cause any more irritation or skin breakdown. Okay, so once that's secured, depending on where you're at, some places you might have to date, time, and initial on a piece of tape and stick that on your dressing. Other places it's just all in your documentation. I cover my patient up and reaching underneath. I put that up and dispose of it according to hospital policy. I make sure my patient has his call light and ask Mr. Smith, are you comfortable? How did that go? Did you have any pain? He says no. And when I'm doing the dressing change, I assess. If he appears to be having any pain or uncomfortable, then, then we may need to pre-medicate even though he says he's not having pain. Some of these dressing changes can be painful. Even though the patient may not be having pain before we do it, we need to pre-medicate him anyways. I put my bed back down in low. I clean up my supplies, I wash my hands, and then I'm going to document. And when I document, I need to document drainage, I need to document what the incision or the wound looked like, I need to document that it was done per sterile technique, and I need to document how the patient tolerated it. And then when I'm going back into the room and assessing my patient for other things and other needs, I need to be looking at that dressing and making sure that he's not leaking through that dressing. And that's it.